Yes, patient assessment trauma. You have 10 minutes to complete. You are dispatched to a patient with multiple gunshot wounds. PD's on scene.
Okay. BSI, is my scene safe?
Yes.
Okay. I'm going to go ahead and say, is this my only patient?
Yes.
And MOI would be gunshot wounds.
Okay.
Requesting additional EMS and consider C-spine for this patient.
Okay. You walk up to the patient. He's laying on the ground. Large pool of blood under him. Cops say he's been shot 2 times.
2 times, okay. All right. So at this time, I'm going to check responsiveness of my patient. Do I get anything?
He's alert.
Alert, okay. I'm going to say this is my general impression of this patient is poor.
Okay.
Multiple gunshot wounds. And I'm going to assess for any obvious life-threatening bleeding.
You see spurting bright red blood coming from his left leg.
From his left leg? Okay.
Yeah, high.
All right, so I'm going to go ahead and tourniquet the leg.
Okay.
High and tight. And did that control the bleeding?
Yes.
Okay. All right, what about the gunshot wounds? Is there anything going on in the chest? Anything I need to be worried about? Any life-threatening bleeding?
No life-threatening bleeding.
Okay. All right, so moving forward, I'm going to check the ABCs, airway. Do I notice any air obstructions or any vomitus or anything?
No.
Okay. Breathing, how's my patient's breathing?
Rapid and regular.
Rapid and regular, okay. Is there any obvious injuries to the breathing that I need to be treating at this moment?
No.
Okay. All right, so moving to circulation, what's my patient's skin color, temperature, condition?
Pale, cool, diaphoretic.
Okay. All right. Going to treat for shock, high flow oxygen, non-rebreather, 15 liters per minute.
Okay.
And a blanket to keep patient warm.
Okay.
All right. I'm going to get partners to get OPQRST and a sample history, either from the patient or bystanders or law enforcement. And this is a high priority transport. We're going to get this patient to the hospital as quickly as possible.
Okay.
And we're going to go ahead and get 2 IVs, large bore IVs, and either bilaterally, and I'm going to get some vitals. What do I get for a blood pressure?
100 over 50, pulses 115 regular, respirations are 18 and regular.
Okay.
BGL's 100.
Okay.
Anything else you want to know?
Did you say SBO2 already?
98% on your 15 liters.
Okay, perfect. All right. So I'm going to go ahead and start my secondary assessment. Palpating the head. Do I notice any decap BTLS?
Clear.
Eyes. Do I have any raccoon eyes? Or how? And what are the pupils? Are they pearl?
Pearl. Clear.
Okay. Ears. Do I notice any fluid coming out of the ears?
No.
Battle signs behind the ears?
No.
Okay. Feeling on the neck. Do I notice any step offs? Anything there?
No.
Looking for tracheal deviation and JVD.
Clear.
Recess in the airway. Is it patent?
Yes.
Okay. All right. I'm going to palpate the chest. Anything noticeable there?
Yeah, you see a gunshot wound. Right upper quadrant of his chest.
Okay. Gunshot wound there. I'm going to go ahead and treat that with a chest seal.
Okay.
Since there's one here, is there an exit wound on the back side?
Yes.
Okay. I'm going to also put a chest seal on that.
Okay.
And keep moving forward. Do I notice anything else in the chest?
Nope.
Okay. I'm going to auscultate. Do I get good lung sounds?
Diminished and present.
Diminished and present. Okay. I'm going to have a BVM on standby just in case the patient needs some ventilations.
Okay.
All right. Palpating the abdomen. Do I notice anything there?
Clear.
Clear. Okay. Palpating pressing in and down on the pelvis. Any instability?
Stable.
Stable. Okay. Priapism. Is there priapism?
Clear.
Okay. You said, so was it the left leg that had the gunshot wound? Or the bleeding?
Yes.
Okay. So checking that, reassessing the tourniquet, is it working?
Yes.
Okay, obviously I'm not going to get CMS on that leg. Checking the right leg, do I notice any injuries, any bleeding?
No, he's clear.
Okay, CMS good?
Yes.
All right, upper extremities, checking for any injuries.
Clear.
Clear, CMS good?
Yes.
Okay. All right, now treatment for this patient. I'm going to go ahead and say IV, we're going to give 20 milligrams per kilogram fluid, LR, and we're going to give fentanyl 1 microgram per kilogram for this patient. Reassessing vitals, all interventions, airway, and the chest seals. And we're going to be rapid transport to the closest available facility or trauma center.
Cool.
And I'm done with this patient.
Anything else you want to add, Jess?
I don't think so.
Cool.